It can be really annoying to wake up with a stiff neck, and it's even worse if it's stabbing pain. But for some people, it's chronic, and neck pain is an everyday reality. Dr. Christina Captain is the lead practitioner at the Sarasota Center for Acupuncture and Nutrition. She's here to offer some hope, which is such an important word anytime pain is involved.
Oh my goodness, yes.
Okay, so let's talk about neck pain. When it's chronic, how does that alter our everyday lives?
So imagine this, Stephanie. You wake up and you are frozen in this position and you cannot turn your head to the left or the right, and you're using your whole body to turn yourself, or you're just using your eyes.
Sounds irritating.
Right?
At the very least.
Right.
Yeah.
And all of that is accompanied by pain. How did somebody get there? Well, maybe they have a whiplash that they don't take care of. Maybe they have degenerative disc disease. Maybe they have osteoarthritis. And maybe they have stenosis. And so they're eventually, oh, that hurts, I'm going to just go to here. And then, oh, that hurts, I'm just going to go to here. And then, oh, that hurts, until they're just here. And they can't move unless they're moving the entire thoracic spine, which is the middle spine here, right? And that's how they're looking. Imagine driving like that, trying to look by turning your entire mid-spine.
And that's not helping anybody, including the rest of us on the roads.
So we consider ourselves public safety members because
okay, good. I appreciate that.
We are helping people be safe on the road in Sarasota.
So when someone comes and they are literally compromised motion-wise, where do you begin?
Well, first of all, we want to make sure that they've been checked out by their primary care, orthopedic, or neurology, whoever is going to deal with that for them, making sure there's nothing that has to be done immediately surgically. There are issues with spinal cord compressions that are emergencies, so that those kinds of things have to be dealt with. Typically in a chronic case, they've already gone through physical therapy, they've already had, workups by their doctors and specialists, and so in that case, we're ready to go. And what we're going to do is we're going to assess them. We're going to make sure that they understand that it's not going to be one and done. You're not going to have one session of acupuncture and go, woo, I can move my head. That's a party trick.
It's a miracle.
Sometimes that can happen for people who slept wrong one day, and that may be, we call it a party trick. It's not going to last. We can get you moving pretty well, but it takes a lot of sessions to get you from this with lots of pain to movement without pain, right, in that neck.
But the takeaway is it can get you there.
Yes, it can.
I mean, that's a big takeaway without spine surgery, without scary things.
Yeah, let me tell you a story. We have a multitude of patients coming in right now with sort of like frozen neck syndrome, we'll call it. It's not, I made that up, so I'm not sure if that's a real term or not.
That's not a doctor term.
It's a doctor captainism, but I don't really know if that's true or not. Anyway, so we have a lot of people coming in. We have one lady in particular coming in who really just couldn't move, and she was just like, I'm desperate. I have tried everything to get this pain to go away and for me to move my head. I can't move my head. And you know what? It takes a bit. She came in really well. She was coming in twice a week like she should. About the 11th session, she said, I had an entire day without pain and I can move my head a little. And I'm like, oh my goodness. All right, great. She's at like another week or two into it, and she goes, I had 2 days without any pain at all, and I can actually move my head to talk to my friend. I couldn't believe I could do that. So the hope is there. People come in and they're like, I don't have any hope. I can't do this. I've been everywhere. I've done everything. I have no hope around this. And boom, it's difficult. Again, another story, had another new mom come in, had a major car accident years before, had spine issues in the lumbar, lower spine, lots of pain, can't move, can't pick up her baby, lots of pain, right, in bed. Sitting talking to her, hey, listen, let's try this. You've tried everything else. She's a doctor, can't even function as a doctor, had to go part-time. Let's try this. Let's see if this works for you. I really feel I can get you to this place. She came in the other day, she said, and she's crying. I did not believe you. I didn't believe that you were telling me the truth all the way. When you told me I could go back to pick up my baby, when you told me that I could go back to doing sports, when you told me I could be normal and be a doctor again, I didn't believe you. But guess what? This week I've done all of those things. And I was like,
special.
Woo!
And that's why you do what you do.
Exactly.
But the takeaway is there's no one-size-fits-all answer. And to have a Western medicine doctor know that the prescriptions weren't helping her, I'm sure she was trying to avoid surgery, because aren't we all?
She already had surgery.
Oh, even worse. You did it and it was unsuccessful.
Right.
There are still other things to try.
Goodness.
So that, I think, is such an amazing option for anybody that is suffering in pain. try it as an approach, but know that there's a commitment. That's an important takeaway.
It's a commitment. It definitely is. And anything that makes you feel healthy, it is a commitment. And it's always a commitment.
You're right.
And that's what makes us so different from a lot of other pain clinics in the area and acupuncture clinics in the area. First of all, we integrate with your Western team. We're going to deal with all of your conventional players. But number two is we are really in it. We're just as committed as you. We're not just saying, oh, this is a business, take your money. This is really about how can we help you? How can we make a difference? My clinic is founded on making a difference every day in any way we can. And we are so blessed by that. And so if you have these problems, please come and see us. It doesn't really cost that much to come in to just chat with us and see if we can help you.
Absolutely. And the end result is a better quality of life. And that is certainly what we are all looking for. Maybe make it the New Year resolution to do something for yourself. That's what Dr. Captain and her team are all about. Whether it's chronic neck pain help or anything else that you are suffering from, you can find Dr. Captain by going to scansrq.com. We'll be right back.